Is it true that something you might only associate with being young, or perhaps something you don't really talk about, could actually be incredibly important for your health as you get older? Could neglecting this one private act have surprising effects on your well-being? It's a topic many people shy away from discussing openly, but there's a growing conversation among health professionals about the role of intimacy and self-care throughout our lives, including into our later years. You might feel it's something you've left behind or perhaps never really thought about in this context. But what if I told you that doctors are indeed pointing to potential downsides of completely stopping a certain personal activity as you age? It's a reality that ignoring your physical and emotional needs in this area can lead to missing out on some surprising benefits. We often focus on diet, exercise, and social connection for healthy aging, but there's a private piece of the puzzle that's often overlooked. In this video, we're going to explore this sensitive topic with the insights from health perspectives, looking at some of the surprising things that can happen if you completely neglect this aspect of self-care in older age. Stay with me until the very end, because some of what we'll discuss might just change the way you think about staying healthy and happy as you get older. It could even surprise you with how much it connects to your overall vitality. Let's start by talking about something that often becomes a quiet challenge as we age, and that is physical health, particularly areas related to circulation and certain specific body parts. As the years go by, it's natural for our bodies to change. Circulation might not be quite what it once was, and some physical functions can become less robust if not used or stimulated. Now, when we talk about something like masturbation, we're not just talking about pleasure, we're also talking about a physical act that involves increased heart rate, blood flow, and muscle contractions. Think about it, engaging in this activity is a form of physical exertion, albeit a mild one for most people. It gets the blood pumping, which is beneficial for cardiovascular health in general. Good circulation is vital for everything from brain function to keeping your limbs healthy. When blood flow is regular and strong, oxygen and nutrients get delivered efficiently throughout the body. If you completely cease any activity that elevates your heart rate even slightly and promotes blood flow to specific areas, those areas can become less responsive, potentially contributing to a general decline in physical tone and function. Specifically for men, engaging in this activity can be relevant to prostate health. The prostate gland is a common source of issues for older men. While research is ongoing and it's not a guaranteed preventative measure, some studies suggest a potential link between regular ejaculation and a reduced risk of prostate cancer. One theory is that ejaculation helps to flush out potential carcinogens from the prostate ducts, reducing inflammation and the buildup of substances that could contribute to cancer development. If a man stops masturbating or having sex entirely, that potential flushing mechanism is lost. Now, of course, prostate health is complex and influenced by many factors like genetics, diet, and overall lifestyle, but maintaining some level of sexual activity or self-stimulation is something that's being looked at as a potential piece of the puzzle for maintaining prostate health in later years. Ignoring this aspect could mean missing out on a simple potential preventative measure. For women, the physical benefits can relate more to pelvic floor health and vaginal health. As women age, hormonal changes, particularly after menopause, can lead to thinning and drying of vaginal tissues, a condition known as vaginal atrophy. This can cause discomfort, pain during sex, and even increase the risk of urinary tract infections. Engaging in sexual activity, including masturbation, helps to increase blood flow to the vaginal area, which can improve lubrication, maintain tissue elasticity, and overall vaginal health. It helps keep the tissues toned and pliable. If a woman stops all forms of sexual activity, the lack of blood flow and stimulation can exacerbate the symptoms of vaginal atrophy, leading to more dryness, discomfort, and potential issues. It's a classic case of use it or lose it when it comes to tissue health and elasticity in this area. Maintaining some level of stimulation helps keep things healthier and more comfortable. Neglecting this completely means potentially facing more severe discomfort and health issues related to vaginal dryness and pelvic floor weakness, which can contribute to problems like incontinence. The pelvic floor muscles are also gently worked during arousal and orgasm, and keeping these muscles toned is important for bladder and bowel control as well as supporting pelvic organs. Lack of activity means these muscles may weaken faster, contributing to those common age-related issues. Beyond these specific areas, the act itself provides a mild form of physical release and tension reduction. Think of it as a mini workout for certain parts of your body and a way to release stored physical tension. If you stop engaging in this activity completely, you're missing out on this regular release. This tension can manifest in other ways, potentially contributing to restlessness, discomfort, or even affecting sleep patterns. It's a natural bodily function, and suppressing or neglecting it entirely doesn't necessarily make those physical needs or tensions disappear. Instead, they might linger, subtly impacting your physical comfort and overall sense of ease in your own body. The physical sensations associated with arousal and orgasm also involve the release of endorphins, which are natural pain relievers and mood boosters. So, on a purely physical level, stopping this activity means you are foregoing a regular opportunity for your body to release these beneficial chemicals which help you feel good and reduce discomfort. It's a simple, accessible way to tap into your body's natural feel-good system. Now, let's shift gears slightly and talk about something just as crucial but often less discussed: mental and emotional well-being as we age. It's easy to focus on physical health markers, but how we feel inside our heads and hearts profoundly impacts our quality of life, especially in later years. Many people experience loneliness, isolation, or changes in self-esteem as they get older. Roles change, loved ones may pass on, and social circles can shrink. In this context, maintaining a connection with your own body and experiencing pleasure can play a vital role in preserving mental and emotional health. Masturbation isn't just a physical act. For many, it's also a form of self-care, a way to connect with oneself, and a source of pleasure and comfort. It can be a private moment of intimacy with yourself, something that is solely for your own enjoyment with no expectations or pressures from anyone else. Ignoring this aspect of self-care completely can subtly impact your mood and overall sense of well-being. The act of masturbation triggers the release of several neurochemicals, including dopamine, serotonin, and those wonderful endorphins we mentioned earlier. These are chemicals often associated with feelings of happiness, pleasure, and relaxation. They are the body's natural mood elevators and stress relievers. If you completely stop engaging in this activity, you are effectively cutting off a regular and accessible source of these beneficial chemicals. While there are many ways to boost these neurochemicals, like exercise, social interaction, or hobbies, this specific activity provides a unique combination of physical release and neurochemical reward that can be particularly effective for some individuals. Missing out on this regular boost can potentially leave you feeling a bit more down, more stressed, or generally less buoyant than you otherwise might. Furthermore, masturbation can be a powerful tool for stress reduction and relaxation. In older age, stress can come from various sources: health concerns, financial worries, caregiving responsibilities, or the emotional toll of loss. Finding healthy ways to manage stress is paramount. The process of arousal and orgasm provides a physical and mental release of tension. It can distract from worries for a period and leave you feeling more relaxed and calm afterward. It can be a deliberate act of letting go of the day's stresses. If you eliminate this activity entirely, you are losing one potential avenue for stress relief. While deep breathing, meditation, or a warm bath are also effective for some people, the combination of physical sensation and neurochemical release from masturbation offers a unique form of relaxation that can be incredibly beneficial. Ignoring this tool means you might be missing out on a simple yet effective way to unwind and de-stress on a regular basis. Another significant aspect is the impact on sleep quality. Sleep disturbances are common in older adults. Factors like pain medication, sleep apnea, and restless leg syndrome can all play a role, but stress, anxiety, and physical tension can also contribute significantly to difficulty falling asleep or staying asleep. The relaxation and stress reduction benefits of masturbation, particularly when done before bed, can be a natural sleep aid. The release of tension and the calming effect of the neurochemicals released can make it easier to drift off to sleep and may even lead to deeper, more restful sleep. Many people find that the post-orgasm relaxation is a very effective way to transition into sleep. If you are struggling with sleep and have completely dismissed or stopped this activity, you might be overlooking a natural and accessible way to improve your sleep hygiene. Ignoring this potential benefit means potentially continuing to struggle with sleep issues that this simple act might help alleviate. It's a natural bodily function that can help regulate your sleep cycle by promoting relaxation and reducing anxiety before bedtime. Finally, let's touch upon self-esteem and body image. As bodies change with age, it's not uncommon for people to struggle with how they see themselves. Illnesses, physical limitations, and societal beauty standards can all contribute to feelings of inadequacy or decreased self-worth. Engaging in masturbation can be an act of self-love and acceptance. It allows you to connect with your body, experience pleasure from it, and affirm that your body is still capable of feeling good regardless of its age or any limitations. It's a private affirmation of your own desirability and capacity for pleasure. If you completely avoid this activity, you might be reinforcing a narrative that your body is no longer a source of pleasure, or that you are not worthy of experiencing physical intimacy, even with yourself. This can subtly erode self-esteem over time. Maintaining this connection through self-pleasure helps keep you in touch with your sensual side and affirms that your body is still yours to explore and enjoy. Ignoring this means potentially missing out on a simple way to maintain a positive relationship with your changing body and nurture your self-esteem. So, we've explored some of the physical aspects from circulation and prostate health to pelvic floor and vaginal health, and then delved into the mental and emotional benefits like mood regulation, stress reduction, improved sleep, and boosted self-esteem. It's clear that neglecting this part of your life isn't just about missing out on pleasure. It can have tangible impacts on your overall health and well-being as you age. The warning isn't about some dramatic punishment, but rather about the potential for missing out on these widespread benefits and potentially facing common age-related issues that this activity could help mitigate. It's about recognizing that sexual health and self-care are lifelong aspects of being human, not something that suddenly stops being relevant at a certain age. For men, maintaining regular ejaculation, whether through masturbation or partnered sex, can contribute to that potential prostate health benefit we discussed. It's not the be-all and end-all of prostate care, but it's a lifestyle factor that health professionals are taking more seriously. For women, continued stimulation and blood flow to the vaginal area is crucial for maintaining tissue health, preventing dryness, and reducing discomfort. It helps keep the area supple and reduces the risk of related issues like UTIs. Ignoring this means potentially resigning yourself to discomfort that is, in many cases, manageable or preventable through regular self-care. Beyond the specific physical benefits, think about the cumulative effect of the stress reduction and mood improvement. Lower stress over time means less wear and tear on your body. Better mood contributes to greater resilience and a more positive outlook on life, which itself is linked to better health outcomes. Getting more restful sleep has a ripple effect on everything from cognitive function and energy levels to immune health. If you've been dismissing masturbation as irrelevant or inappropriate for your age, consider the potential health advantages you might be inadvertently sacrificing. It's a simple, free, and accessible way to tap into your body's natural capacity for healing and well-being. It's also important to address any lingering feelings of shame or embarrassment that might be associated with this topic. Many people, particularly from older generations, grew up in cultures where sex and masturbation were not openly discussed and were often viewed negatively. Carrying that baggage can prevent you from considering this activity as a legitimate form of self-care. However, health perspectives today are much more holistic, recognizing the interconnectedness of physical, mental, and emotional health. Releasing these old inhibitions and embracing masturbation as a normal, healthy part of human sexuality and self-care is crucial for accessing its benefits. It's a private act that is entirely your own and can be a powerful affirmation of your autonomy and right to pleasure. So, if you haven't considered this aspect of self-care in your later years, or if you've stopped completely, it might be worth rethinking. It's not about obligation or pressure. It's about recognizing a potential tool for enhancing your physical and mental health. It's about giving yourself permission to experience pleasure and connect with your body in a way that is entirely safe and personal. The potential downsides of not engaging are not about some dramatic event, but about gradually missing out on opportunities for improved circulation, better tissue health, stress relief, mood enhancement, and better sleep. All things that contribute significantly to your quality of life as you age. Remember, small changes and a willingness to explore can make a big difference to your health and happiness at any age. Thinking differently about topics like this, even sensitive ones, can open up new possibilities for feeling better. We've covered a lot of ground, looking at how this private act connects to everything from prostate health and pelvic tone to your daily mood and sleep quality. It's a powerful reminder that taking care of yourself involves listening to your body and mind in sometimes surprising ways. If anything in this discussion resonated with you or sparked a thought, I'd love to hear from you. Sharing your perspective in the comments below can help others feel less alone or encourage them to think about their own well-being. And if you found this information helpful or thought-provoking, please give this video a like. It helps others find this important conversation. And don't forget to subscribe to the channel for more discussions on staying healthy, happy, and vibrant at every stage of life. Embracing all aspects of yourself is part of living your best life at every age.